Okay, how to introduce Vidhya. I didn't have a prepare for this either. But then I thought the only thing that I thought would be mildly illuminating and mildly funny, not very funny or very illuminating, was I think a few months ago, was it about 3 months ago, Vidhya wrote, "Oh, I said, how are you, Vidhya? Oh, I'm just considering. I've got 2 job offers at the moment, and I'm just considering which one to take." And well, partly I said, "Well, Vidhya, I've never had 2 job offers in the whole of my life." You know, so I was kind of amazed that you could have 2 at the same time. But Vidhya is the kind of person who does have 2 or 3 or 4 job offers at the same time. So she's very bright, thoughtful. But with that, the other thing I remember from a recent conversation with Vidhya is, I think Vidhya summarised the problem that we're trying to tackle rather beautifully. She said, "You know, the problem is the system, just think people are a bit thick, don't they?" And I think that does summarise part of the problem. You know, what we're battling against here is deep, deep paternalism about ordinary citizens, and it's going to be a big battle. But at least it's helpful if some people have observed what the problem is to begin with. So, Vidhya.
Well, thank you for that introduction. I think that's the best introduction I'll ever have. And thank you for inviting me to be here of that illustrious group of fellows. I'm very privileged to get to talk to you today. Last Friday I was up in Leeds working with some of the pilot sites that are working on the personal health budgets pilot, which is a Department of Health pilot that I'll talk a little bit more about. And somebody told me the story of this young man who's 28, so let's call him John. And about just over a year ago, John decided to try diving into a lake in Northamptonshire, and it went horribly wrong. And he then spent over a year in hospital, and about 3 months ago, he got released from hospital. He's unfortunately now paralysed from the neck down, but he's back in his home trying to re-establish his life. And he's fortunate to be part of a personal health budget pilot in the place where he lives. And one of the things that he wanted to do with his money from the NHS that he thought he had control over was go swimming. Kind of quite a small ask. And when it was put to the professionals that were involved in his care that John wanted to go swimming, their response was absolutely no way. You know, the guy's paralysed from the neck down, he can't go swimming. What a stupid idea. And my question to you is, who's right? John and his desire to go swimming, or the people who are responsible for his care? And is the role of the NHS to say, no, you can't do that, or to try and find ways to support John to do the things that he wants to do and to live the life that he wants to do? And, you know, it may be that in time John will figure out that swimming's not what he can do or should be doing, but we haven't even given him a chance. We're not even letting him have a go. And I think, you know, as Phil and Simon have said, and Claire, a lot of what we as a centre work on is trying to give people more control over their lives and give them the ability to live the lives that they choose. And I suppose I do that within the context of health. Other people think about other parts of the public service system. And there's some bullets up there about why this matters, and I just wanted to dwell on 3. First, the nature of disease has changed, and even if you care about this from a public spending, running the government perspective, we spend most of our money now on chronic disease, and managing chronic disease depends on me and you, and much less on professionals. You don't spend that much time in a doctor's surgery or at the hospital. Most of what you need to do to manage diabetes or a mental health condition resides with you, your family, and your network of support. So really giving people more control is really the only way we can go to manage these kinds of conditions. The second is that all the evidence shows that respecting people's needs and preferences makes health outcomes better. If your main goal in life is to make sure you live long enough to see your grandchildren graduate, if healthcare taps into that and works with you on that, you're much more likely to stick to your treatment, you're much more likely to make your appointments, you're much more likely to be invested in this whole endeavour to keep you well and healthy, and that's going to make your health outcomes much, much better. And then the third is, I think we've kind of got to the end of the road of forcing people to live in the different silos of government departments, so that, you know, you have an employment programme under DWP and you have a health service under the NHS, but actually for most people having a job is a big part of staying well and being happy and being mentally well. So allowing people to control service money in order to fashion the life that they choose, and to break down these silos that says this is your employment and that's about, you know, your livelihood, and this is your health and that's about staying well. Just, you know, that surely makes much more sense to people and would save us a lot of money. But before you think I've gone crazy, you know, this isn't the solution to all parts of healthcare. There are clearly situations where we're in extreme distress, where there are emergency situations where we need and want the full participation and we want other people to take control of situations. You know, nobody wants to be going to A&E and being asked, well, how would you like to spend your personal health budget, ma'am? That is not what we're talking about. So this chart, which Simon and I have been iterating on and was first developed by Paul Hodgkin, who runs Patient Opinion with Simon, really tries to set out where we think this might work best. And what we're moving towards is a sense that the more grey the evidence is, and there are huge areas of healthcare where the evidence is incredibly grey, and the more what I care about matters to the outcome that we're trying to achieve, the more we're in the territory of giving individuals control. And, you know, this is a work in progress, so any thoughts about where this would work, we're all ears. And I also, in the same way that Claire did, wanted to sort of end on a slightly more positive note. This is an evening of challenge to the system, but there is some evidence that this works. We don't have randomized control trials yet with lots of academic style evidence, but we have stories of people's lives that have already changed because they've chosen to work in this way, and the people around them have allowed them to work in this way. So the man in the corner there is a guy called Joe Mockbee, who lives in a great place called Kalamazoo in Michigan in the US. And I had the privilege of spending 3 years in America looking at how these programs work out there. And Joe was one of the people I got to know. And Joe loves art, and he's a really talented artist, and he does these great sort of comic drawings. He also happens to have a mental health condition, quite a serious one. But he's relatively well and has been for quite a long time. But for 20 years, he'd be going to a job program, and he'd go there, you know, most days, and he'd sit around with his friends and he'd drink some coffee. Some of them would smoke some cigarettes, and then, you know, 20 years had gone past, he still hadn't got a job. And it would cost the state quite a lot of money to keep him in this job program. When he got control of his money, he thought, actually, I'm quite good at this art thing, and maybe I could make that a job and get something of a livelihood out of that and gradually move off benefits. So he hired the lady who's next to him, who was an art student, and they used to go to art galleries together, and she would sort of work with him to think about, well, if you're going to have an exhibition, how would you mount your art? How would you market it? How could you sell it? All those kinds of things. And it gradually started to pay off, and he was getting small commissions from local organisations. The community wanted to run a big summer event, and so they commissioned him to do the work. And you know, he hasn't gone from being person in a job program to a world-renowned artist overnight, but he is slowly making progress towards moving off the benefit system and being able to support himself and do something he loves and stay well at the same time, because this is what keeps him well. It's fulfilling the passion that he has in life for his art. So I'll leave it at that.